This video will demonstrate the proper setup and technique for operating the Accutome A-Scan Connect. Opening the box. When the A-Scan Connect first arrives, open the shipping container. Remove the literature packet containing the fixation target and A-Scan carrying case. The fixation target can be placed on the ceiling above the head of the exam chair to help the patient fixate. Inside the carrying case, you'll find instructions, installation software, the A-Scan Connect control unit, USB cable, foot switch, test block, probe, and immersion shell. The Accutome A-Scan Connect is a PC-based system that operates off the power of the local PC or laptop. Open the software installation package and follow the instructions that are provided in the packet. Please be sure you're following the appropriate instructions for your computer specifications. Plugging in the unit. Once the software is installed, attach the USB cable to the A-Scan Connect and computer. Connect the probe to the unit. The A-Scan control unit may take a few moments to install. The light on the unit will turn green when the unit is ready for operation. If desired, the USB foot switch can also be connected to the computer. Operating the software. Once installed, the Accutome logo will appear on your desktop. In order to start the software, simply click on the icon. The software will open on the exam screen. You will see 4 tabs on the top: Exams, Measurement, IOL Calculation, and Setup. On the screen, you see an icon labeled New. To start a new study, click this icon. Fill in the resulting screen with all of the patient's demographic information and press the Done icon at the bottom right. The software will automatically take you to the measurement screen. To start a measurement, insert the probe into the immersion shell to the proper depth. It is important to not place the probe past the scored line. Lightly tighten the set screw to fix the probe in place. Connect the tubing and balanced salt solution to the shell. Recline the patient and administer the anesthetic drops in the upper and lower part of the eye. Once the drops are in the eye, prepare for the test by verifying that all measurement screen settings are correct. Confirm that the proper eye is selected, OD/OS. Proper measurement type is selected, auto or manual. Correct eye type is selected, and also that the type of scan is correct, contact or immersion. With the patient reclined, ask them to fixate at a target on the ceiling and gently place the immersion shell into the patient's eye between the lids, ensuring that the shell is properly placed on the sclera and has no contact with the cornea. Once the shell is in place, release the upper and lower lids, allowing them to form a seal with a shell which retains the balanced salt solution and does not allow leakage. Press and hold the foot pedal and gently squeeze the balanced salt solution bottle until the fluid in the shell reaches the probe and a waveform appears on the computer screen. If needed, adjust the shell slightly to properly align the sound beam along the visual axis in order to achieve the proper waveform pattern. The A-Scan will rapidly capture 5 axial length measurements. Gently tap the foot pedal to review the scans. Once all scans have been reviewed and deemed acceptable, gently remove the shell from the patient's eye by tilting the shell toward the nose bridge and capturing the water in a tissue. Once the scans are completed, select the IOL Calculation tab. The average axial length will automatically be transferred to this screen. Select the appropriate IOL group. Input the K1 and K2 values. Make an adjustment to the refractive outcome target, if desired. Select the appropriate calculation formula. The IOL power recommendation will appear in bold for each lens. It is important to select the Save icon at the bottom center of the screen to save all information. If you do not click the Save icon, you will lose your data. If desired, select the Print icon to generate a PDF or send to a local printer. Calibration. The Accutome A-Scan does not require any calibration. Cleaning. Clean the A-Scan probe by wiping or soaking only the tip with alcohol. If a higher level of disinfection is required, an antibacterial solution such as Cydex or Sporicidin is an acceptable infection control technique. The immersion shell can be fully submersed in alcohol, Cydex, or Sporicidin. Do not autoclave either the probe or immersion shell. Please feel free to contact your Accutome representative regarding any questions or to purchase any of the necessary supplies to complete the A-Scan examination.